One of the most common things I see in clinic is men experiencing symptoms of low testosterone, but not always realizing that what's going on. Testosterone plays a key role in energy levels, mood, libido, muscle mass, and even cognitive function. When levels start to decline, men may notice fatigue, reduced motivation, poor recovery from exercise, increased body fat, or a drop in sex drive. The challenge is that these symptoms are often gradual and can be mistaken for stress, aging, or lifestyle factors. On top of that, standard blood tests don't always tell the full story. That's where a more personalised and detailed assessment becomes important. At the WellMan Clinic, we look at the full hormonal picture, your symptoms, and your overall health to determine whether testosterone optimisation, or testosterone replacement therapy known as TRT, is appropriate. When prescribed correctly and monitored carefully, TRT can be a safe and effective way to restore hormone levels and significantly improve quality of life. However, it's not a one-size-fits-all treatment, and it's important that it's done properly with expert guidance, regular monitoring, and a tailored approach. If you've been feeling persistently low in energy, struggling with performance, or just not quite yourself, it may be worth exploring whether your hormones could be playing a role.